substance. He's probably more responsible than anyone I know about spreading the word on the incredible benefits of glutathione. So, without further ado, Dr. Gutman, are you with us tonight?
I am. Thank you very much, Doug.
And what are we talking about tonight, Doc?
Well, we're going to be talking about glutathione in pregnancy. Um, and I have to tell you, when I first got to Immunotech, this is a long time ago, and started working with Dr. Bunos and Dr. Kongshaven, I was asked a question, can somebody who's pregnant take Immunocal? Well, let me find out. And I spoke to Dr. Bunos. I said, Dr. Bunos, can someone who's pregnant take Immunocal? And he says, well, no. So that's interesting. Do you know why? And Gus said, no. Then I went to Dr. Kongshaven and I asked her the same question, and her response was the same. No, we can't say that a pregnant woman can take Immunocal. I was wondering why. So I started looking this up, and everywhere I looked, it seemed that glutathione was something that pregnant women should be raising. And until I figured out the people who are telling us to respond in this fashion, to say no to the question, can a pregnant woman take Immunocal? We're the lawyers, because there's so many things that can go wrong during a pregnancy. It's after all, a high risk state. And I figured I would change that. So I wrote a whole chapter on glutathione, lactation, childbirth, and everything I read suggested that a pregnant woman should be taking glutathione. So that's going to be our topic tonight, Doug. So I'm just going to try to share my screen here. If you just give me a moment.
Sounds excellent, Dr. Gutman. As always, there's 165 of eager students waiting to hear what you have to say.
That being said, the pregnancy is full of hazards and potential complications. Women undergo dramatic physiological changes more than any other time. And the mother and the child are both at the mercy of their genetic makeup, which may be the main cause of some of these challenges, but they're also susceptible to the environment, mainly the air, the food, and liquids they consume. And it's especially important to avoid or limit exposure to toxins and teratogens. Teratogen is a substance causing a birth defect. So here is a short list of complications of pregnancy that can happen as a result of oxidative stress, free radical damage, and of course, low glutathione levels, eclampsia, preeclampsia, gestational diabetes, gestational hypertension, congenital abnormalities, and more. So today we're going to cover some of the more common ones, examine what they are, and the role that glutathione plays in each. So let's start with preeclampsia, eclampsia, and hypertension or high blood pressure in pregnancy. It's not unusual for pregnant women to experience hypertension. This is caused by hormonal shifts and changes in blood volume and circulation. Some women are always hypertensive, while some experience this problem only during pregnancy. And about 1 in 20 has a more serious condition called preeclampsia. Now, symptoms of preeclampsia are hypertension, proteinuria, which is protein in the urine, and edema, the accumulation of water in the tissues leading to swelling, particularly the hands and the feet and the face. It usually occurs between the 20th week of gestation and the week following birth. If left unchecked, 1 in every 200 cases of preeclampsia turns out to be full-blown eclampsia, a very serious condition which is associated with convulsive seizures and coma. And if not addressed promptly, eclampsia is usually fatal. So it must be treated aggressively. And the treatment for mild cases of preeclampsia includes bed rest, increased fluid intake, and nutritional support. But the definitive remedy for eclampsia patients is childbirth, which is often has to be induced or by cesarean delivery. Now, the first study reporting abnormally low levels of glutathione in preeclampsia, this dates back to 1958. I guess that's over 60 years ago. And since then, dozens of research teams have noticed that whenever pregnancy is complicated by preeclampsia, there is a dramatic fall in the patient's antioxidant function. Moreover, it's been discovered that the severity of the condition corresponds directly to the level of glutathione deficiency. And as noted, was the increased risk of preeclampsia with age was probably a reflection of the normal drop in glutathione status that accompanies the aging process. And it's notable that many researchers have suggested that the measure of glutathione could be a marker for risk assessment. In other words, glutathione levels can guide the necessity of treating preeclampsia. This can provide the time needed to correct glutathione and antioxidant function. Finally, trials boosting glutathione have shown mixed results, but often with very favorable results. This study here looked at severely preeclamptic patients that were not responding to regular treatment. Raising their glutathione levels led to the reversal of many of the parameters and showed no adverse effects on the fetus. This is very promising. Now, let's look at diabetes and pregnancy, or gestational diabetes. Some women become pregnant following a long history of diabetes, so they were diabetic before, while others suffer the disease's high sugar levels only when pregnant. This is what's called gestational diabetes and occurs in 1 to 3% of pregnancies. A number of gestational diabetics will go on to develop true diabetes later on in their life. Now, the main cause of death among newborn children of diabetic pregnancies is the abnormal development of the child in the uterus, what we call a congenital malformation. In the wombs of diabetic mothers, embryos are more prone to malformations and developmental problems, a phenomenon called embryotoxicity. The exact mechanism of embryotoxicity in diabetes is not entirely clear, but it's known that oxidative damage to cells plays an important role. Low glutathione levels in these patients' embryos put the fetus at the mercy of free radicals. Diabetic mothers also run the risk of larger babies and tougher deliveries. As a result, if birth hasn't occurred by week 42, it's usually induced. And aside from the development defects that these babies are also at higher risk of jaundice, of respiratory difficulties, blood sugar abnormalities, low blood calcium, and other metabolic abnormalities. And many articles have studied glutathione levels in diabetic pregnancies, confirming that diabetics who become pregnant, expectant mothers who develop diabetes, and pre-diabetic women who become pregnant are all prone to increased oxidative stress, free radical damage, and low glutathione levels. In other words, glutathione depletion is apparent at all stages of these pregnancies. Articles have also examined the role of oxidative stress in the uterus of diabetic mothers. Wender Osligua definitively wrote in the journal Free Radical Research, oxidative stress is one of several important factors contributing to unfavorable outcome of the human diabetic pregnancy. In Oxidative Medicine and Cell Longevity, Al Shelby and Masur state that alterations in antioxidant and pro-oxidant components may be regarded as an increased risk factor for pregnant women as well as the fetus. More specifically, the Japanese researchers have reported in the journal Diabetes, our results indicate that glutathione depletion and impaired responsiveness of glutathione synthesizing enzyme to oxidative stress may have important roles in the development of embryonic malformation in diabetes. In simpler terms, the low glutathione and high oxidative stress in diabetic mothers leads to more free radical induced malformations. Now let's take a look at teratogens, a scary topic for anybody expecting a child. Teratogens are substances that disturb the development of an embryo or fetus, often leading to birth defects. We're all exposed to toxins from our environment. They come in the food that we eat, the water we drink, the air that we breathe, the medication we take, the jobs that we hold, and let's not forget the bad habits like drinking and smoking. In pregnancy, the embryo is exposed to the same toxins as the mother, but the complexity of fetal growth development makes it much more susceptible to the development of defects. Consequences range from low birth weight to malformations or even death of the fetus. Some consequences may not appear for years. For example, diminished IQ scores in later childhood. The mother is the only one in a position to minimize these risks. Above all, she must ensure that her built-in detoxification processes are in working order. So oxidative stress is a well-known mechanism of teratogenesis. Many toxins that cause birth abnormalities act by increasing free radical damage. It goes without saying that the protective effects of glutathione are very much in play here. Any factor that lowers glutathione levels may potentially increase the likelihood of defects. And here are just a few congenital defects associated with glutathione depletion: anencephaly, acrania, neural tube defects, and more. A recent article in the Journal of Internal Medicine Research studied glutathione's in the amniotic fluid of pregnant mothers. Ultrasound imaging identified features with congenital neurological defects, who were then compared to those with normal ultrasound results. Glutathione in the amniotic fluid of those defects was significantly lower than those without. Following the Chernobyl nuclear disaster, some of you still remember that, a very significant study was conducted in the Ukraine. Scientists collected the placentas of women affected by radioactive pollution. As expected, the placentas from those living in the most polluted areas had the lowest glutathione levels. They were simply depleted by the overwhelming demands of ongoing radiation. This study showed that the placentas with low glutathione levels experienced more difficult pregnancies, harder deliveries, and poorer postnatal health. They concluded that the glutathione status is a prerequisite of the detoxifying activity of the placental barrier. In other words, placental glutathione, as it's lower, the fetus is unprotected from toxins and from other xenobiotics. But the two most common toxins found in pregnancy are alcohol and tobacco. And most drug-induced malformations of the fetus result from alcohol abuse during pregnancy. This is the number one cause. Although most pregnant women can and do choose to avoid them, abuse of these drugs is not uncommon. The mother may have a habitual dependence on these drugs or simply may be exposed to secondhand smoke. In either case, glutathione plays an important role in protecting the mother and child against this kind of a toxic threat. Alcohol can lead to fetal alcohol syndrome. This is a clinical condition leading to a long list of possible abnormalities, the most being severe mental retardation. At the University of New Mexico, researchers gave test animals glutathione depleting drugs, increasing the severity of fetal alcohol syndrome. On a more positive note, Henderson and his team at the University of Texas used antioxidants on test animals, showing that much of the damage of fetal alcohol exposure could be avoided by maintaining adequate glutathione levels. Women who smoke during pregnancy risk many complications, including early labor, premature rupture of the membranes, and premature delivery. And also, as you expected, low glutathione levels. Unfortunately, this glutathione deficiency extends into their newborn children, which of course put these kids at risk. And as you have heard from me before, glutathione next to water probably is the most important detoxification substance we have in our body. Many studies have shown that the glutathione system plays an indispensable role in detoxifying the newborn child. It removes numerous xenobiotics, including heavy metals such as mercury, lead, cadmium, arsenic, as well as many drugs such as phenytoin and hydantoin and many other potential poisons. One of the major complications around childbirth, the perinatal period, is insufficient oxygen supply to the baby. Before the separation, the baby draws its oxygen from umbilical supplies, but this can be compromised during delivery. Also, a variety of different factors might lead the baby into respiratory difficulties. In either case, the consequences of insufficient oxygen are serious. Every effort is made to avoid it. So again, this condition of insufficient oxygen is called hypoxia. When the baby is given oxygen deprived, individual cells are also deprived and unable to maintain energy level. This leads to hypoxic damage. And glutathione can be considered anti-hypoxic because it stimulates the production of ATP, which carries energy from the power generations, what we call the mitochondria of individual cells. Another complication of the hypoxic child is lipid peroxidation, which is also addressed by glutathione. A less dramatic situation is a condition described as small for gestational age. Small for gestational age babies are when babies are born at the low end of the weight scale. This is not strictly speaking a disease, but it's associated with complications to the placenta and the mother's health, as well as the child. It's been shown that babies born small for gestational age generally suffer increased oxidative damage, and of course, they suffer from low glutathione levels as well. Now, lactation and breastfeeding are usually discussed along pregnancy and childbirth. In this context, glutathione is particularly interesting. You could say it plays the starring role. It's impossible to overstate the benefits of mother's milk on the health and development of newborns, especially its long-term effects on the immune system. Compared with bottle-fed children, those who are breastfed suffer from fewer infectious diseases, especially ear infections and pneumonia, fewer problems with allergies, and fewer cases of childhood cancer, including leukemia, lymphoma, bone tumors, and brain tumors. Compared to the milk of other mammals, human milk has the lowest proportion of all proteins. This may be strange. The makeup is also very different. The two main proteins in milk are whey and casein. And in human milk, the ratio of whey to casein is much higher. It's high in sulfur-containing amino acids such as cysteine and cysteine. Sound familiar? Breastfeeding profoundly affects the baby's immune function by providing high levels of glutathione precursors. How do we ensure that the breast milk retains its high cysteine content? Well, undenatured whey protein is drunk by mom is the perfect solution. Glutathione's role in embryonic, fetal, and placental development is critical. It's constantly working to scavenge free radicals and detoxify dozens of foreign substances and toxins. Without glutathione, these harmful substances accumulate, pushing the child towards a variety of developmental and health problems. Many complications of pregnancy, many, including high blood pressure, preeclampsia, and gestational diabetes, are correlated with low glutathione levels. Decreased glutathione can cause many difficulties in pregnancy. There's a great deal of research carried out with glutathione enhancing strategies to combat these problems, and there has been success and great optimism. And I'm sure that you'll all agree with me when I say that raising glutathione levels in pregnancy should be something that every mother should be doing.